definition of immunosurveillance in the beginning of the lecture. So, what is immunosurveillance? A simple definition.
You say I want to talk about this. You say I want to talk about this.
No, I gave you a simple definition. One sentence. One line. Response against the cancer. Some part of it. Detection, yes. The surveillance of immune system for cancer. It means the immune system detects and kill the cancer. And until now, whatever we have taught, all of them were about immunosurveillance. We talked about immunosurveillance. Yeah? Detection of the cancer and killing of the cancer cell.
Yes.
Everything we talked about them, so I have talked about them. Immunosurveillance, detection and the detection of recognition of the tumor antigens and killing of the tumor cells. All of them are immunosurveillance. So this one other way by which immune system does immunosurveillance or cancer immunosurveillance is the string of viruses, oncogenic virus. When immune system detect and kill oncogenic viruses, indeed immune system prevents cancer formation indirectly. So it's another way of cancer immunosurveillance which is made by immune system. Detection and killing of oncogenic viruses. And I've talked about them. There is important topic in cancer that cancers are categorized in two groups: cold tumors and hot tumors. What is the difference between two types of cancer, hot and cold tumors? In the cold tumors, we do not have immune cells in the cancer, or we have a very low number of immune cells in the cancer. There is no inflammation in the cancer. Okay? When there is no inflammation, there is no immune cells in the cancer, it is called cold tumor. But when we have a lot of immune cells in the cancer, which it's a sign of inflammation. What is the definition of an inflammation? Definition of an inflammation. Calling immune cells, recruitment of immune cells to the site of inflammation, site of damage or infection. Here we have tumor. When there is no calling, there is no recruitment, there is no immune cells. It is called cold tumor. But when there is inflammation, we have calling systems, we have recruitment, so it is called hot tumors. Why is it important? Knowing that a tumor is cold, the other one is hot. What is it important? A little louder, please.
The cold tumors means that the cancer may have a way to evade the immune response.
Yes, here cancer have found way not to activate inflammation. So we do not have inflammation, there is no immune cells here. So it is called cold tumor. It is the definition of cold tumor. Having no immune response, having no inflammation. So the question is this: why does it matter in clinic? Detection or discrimination between hot and cold tumor?
For the dose of the
Treatment,
yes.
therapeutics.
Dose of the therapy, maybe hot tumor need a low dose.
Yes, thank you. Not the dose of the therapeutics, the type of the therapeutics. The type of the therapeutics used in two tumors is different. For example, some immunotherapies are going to activate T cells in the tumor. They are called T cell activators. So, when the tumor is cold, if we use T cell activator, would it be useful here? No, because there is no T cell here. There is no T cell in the tumor to become activated. So T cell activator is an example, is not useful for cold tumor, but it would be useful for hot tumors. We have some T cells that cancer has suppressed them, prevent their activation. So if we use T cell activator, these T cells might be activated, and then we can help the immune system to kill the tumor. Then the last phase of tumor immunology. Immune suppression by tumor or immune escape by tumor, mechanisms by which tumor escape from immune system, suppress immune system. I told you, in normal patient, we have normal cancer immunosurveillance that prevents cancer formation, that detect and kill transformed cells whenever immune system can detect them. Is that clear? When we are normal, when we do not have cancer, it means that our immune system regularly is recognizing transformed cell or cancerous cells and killing them regularly. But if we have a patient with cancer, it means that this cancer has found to evade immune response, to escape from immune, to suppress immune response. Now we are going to talk about this, how a cancer can escape from immune system. And all mechanisms that I'm going to talk about them are made by mutations. There is no thinking. The cancer do not have a think tank to make decision about what to do in the next step. All the things are happens over there by mutation.
I know one mechanism. When the cancer cell enter to the macrophages, and macrophages go to the alveoli, and the alveoli in the lungs.
It's a mechanisms of infectious, for example, Mycobacterium tuberculosis use that mechanism, not for cancer.
It's like this?
No. It's something like that, but not. The mechanism is different. I'll talk about this in the next lecture. So, this is the normal immune response against tumor. We have tumor antigens, different tumor antigens that we have talked about them. Presentation of antigen, activation of T cells by the mechanisms that you know now. APC, antigen presentation, T helper 1 helps, interferon gamma, presentation of antigen, releasing of perforin and granzyme by CTLs, and killing of the tumor. It's a normal immune response. Sometimes tumor cells will express inhibitory proteins or receptors or ligands. I've talked about them. PD-L1, intolerance. Do you remember? I told you that intolerance, when T cells are recognizing self-antigens, they bound to inhibitory receptors, including CTLA4 and PD-L1 and many others, that they are called checkpoints of immune system. Now, tumor use that inhibitory ligand to stop, to suppress, to shut down, to turn off immune cells. We have antigen recognition on the ABC by CTL, but there is binding of one inhibitory ligand to its receptor. After binding of this to this receptor, this cell is indeed switched off, suppress, prevent its activation. It is called indeed expression of inhibitory ligand. Another way is that tumor cells produce suppressor cytokine, including TGF-beta and sometimes IL-10. Those are the important anti-inflammatory or suppressor cytokines. And they are involved in very important intolerance. But cancer cells use this suppressor cytokine to suppress immune system by mutation. Indeed, there are some mutations that enable tumor cell to express this protein. That another mutations that enable tumor cell to produce those cytokines. So by production of suppressor cytokines and suppressory or inhibitory ligands, tumor cells try to prevent activation of T cells and other immune cells. And when we have expression of a lot of those inhibitory ligands and cytokines, and when T cells are exposed to this inhibitory environment, the T cell is called exhausted T cell, tired T cell. This cell tries to recognize the antigen and induce response. But on the other hand, tumor cells try to switch it on. And this try and error by tumor and T cells lead to the exhaustion, tiredness of the T cell. Okay? Another mechanism is using of or recruitment of or calling of suppressory cells, including regulatory T cells, and we can put here macrophage M2 and those type of cytokine cells, MDSCs, those T-rex and M2, you know, they are enough. So tumor cells recruit suppressory cells. Regulatory T cell will produce suppressory cytokine. They will express CTLA4 inhibitory ligands, and M2 macrophage by other mechanisms, again by production of other suppressory cytokines. All of those can again prevent activation of TLP1 and CTL. This is another mechanism. The first one was inhibitory ligand by tumor cells, cytokine production by tumor cells themselves. But here is the recruitment of regulatory T cells, suppressory cells, including regulatory T cell and M2. Another way is antigen loss. It means that the tumor have had an antigen, that immune system T cell has recognized that antigen and has induced an immune response against that antigen. But as a result of mutation, the expression of that antigen that immune system was against it is stopped as a result of mutation. The tumor won't express that antigen that T cell was against it. It is called antigen loss, again as a result of mutation. So when there is no antigen, so T cell cannot recognize that cell. Okay? Clear or not? Clear or not? Feedback. Give me feedback, please. Clear or not? Yes or no? Yes? No? No. So, in normal immune response, there was a tumor antigen, okay? That this tumor antigen has activated this T cell. So we have immune response. It's a normal immune response. Having tumor antigen and a T cell against that antigen, specific to that antigen. Is that clear or no? So, after a while, some tumor cells will prevent the expression of that antigen. That this T cell was against it, was specific to that antigen. There is no antigen. The antigen is suppressed. The production of that antigen is suppressed, is prevented. There is no translation or transcription for that gene as a result of mutation. Okay? It is called antigen loss. Another mechanism is, you know about it, downregulation or prevention of MHC class 1. When there is no MHC class 1, we won't have CTL response. We won't have killing by CTLs, the most effective cells against tumor. As a result of mutation, the expression of MHC class 1 is stopped in some tumor cells. So, and the last one is masking of the tumor antigens by some glycoproteins. For example, there are tumor cells that there are some antigens here. And we have T cells specific to those antigens. But those antigens are masked by glycoproteins, are hidden. There is no access for T cells to those antigens. When there is no access, there is no recognition and there is no immune response. Okay, it is called masking of antigen or making a privileged site or hiding of antigen from immune system. tumors hide the antigens from immune system. Okay? Until now, I've told you several mechanisms, including loss of antigen, downregulation of MHC class 1, recruitment of suppressor cells, production of inhibitory ligands, production of inhibitory cytokines, and hiding of the antigens. There are different mechanisms that some of them are used with some tumors. Different tumors use different mechanisms. It doesn't mean that all tumors use all of them. Each tumor uses some of those mechanisms in order to stop immune activation. Clear? And immunotherapy is the using of immune system, immune component to fight with cancer. I won't go into the details of this topic because you will have a lecture about cancer immunotherapy in your clinical course. I think next summer. I think this winter or next summer you will have a clinical course first, and in clinical year 1 or 2, I'm not sure, you will have cancer immunotherapy and a lecture for that. So you know that for many years chemotherapy and radiation and surgery have been used and being used now for cancer treatment. But recently cancer immunotherapy has revolutionized cancer treatment, and they are widely used in the clinic to treat cancer. And there is some differences. For example, cancer, you know that chemotherapy is not specific to tumor. They harm normal and cancerous cells. Radiation as well. But immunotherapy approaches, most of them are specific to cancer. So the side effects of the treatment is very, very lower compared to the previous one. And sometimes there are memory for immunotherapy, and they are much more efficient compared to chemotherapy and radiation. That's enough. I just want to talk about monoclonal antibodies. What is a clonal lymphocyte?
It's a combination of lymphocytes that have
Which lymphocytes?
T lymphocytes
T or B? Yeah.
that have a specific receptor and a specific antigen.
Yes. A population of T cells that all of them have same TCR or BCR, and all of them indeed are against one epitope. It is called a clone of lymphocytes. How many clones do we have in our body?
More than
Millions of clones. More than 10 millions, and sometimes he said billions of clones, or few billions. Okay? So, when we have a homogeneous population of antibody that all of them are produced just by one clone of lymphocyte. Just by one clone. They are product of one clone. So they are called single clonal antibodies. Antibodies that are produced by a single clone. Just one clone, the product of one clone. We have millions of the clone in the body, and all of them, we are talking about B lymphocytes clone, and all of them can produce antibodies. Let me give you an example. We have, for example, COVID-19 infection. When there is COVID-19 infection, how many clones this COVID can activate? How many clones? 1, 2, 3,
One.
more than
more than one. Why?
Because there is-
Firstly one.
At first one.
Yes.
Why?
Because one cell recognizes the antigen for COVID.
Why more than one?
because this virus have a lot of bonds.
This virus has a lot of proteins. This is a virus. A lot of proteins this virus Has. So that's a lot of protein, and you know that each protein has a lot of epitopes. For example, tens of antigens, and each antigen has again tens of epitopes. So tens of antigens, or sometimes thousands of antigens, each infectious agent has. Is that clear for you? Do you know that we have, for example, an E. coli? E. coli has several proteins, and each protein might have several epitopes. And each epitope can activate how many colon? Each epitope? One colon. Each epitope, one colon. So when a virus has thousands of epitopes, how many colons can activate? 1,000. It is called polyclonal immune response. So let me ask question in another way. In normal immune response against infectious agents, all infectious agents, it doesn't matter, fungi, virus, bacteria, or parasites. It doesn't matter which one. In all infectious immune response against infectious agents, is polyclonal or monoclonal? Normal immune response against infectious agents, E. coli, for example. This is a question of exam. We have an E. coli infections. The immune response is polyclonal. Several antigens, several epitopes. So the response is polyclonal. So in normal immune response against infectious agents, there is no monoclonal immune response. The response is polyclonal. We have activation of several clones. But monoclonal antibodies are produced in the laboratory. Just in the laboratory. In the companies, they produce monoclonal antibodies. In my lab, some of my students are producing some monoclonal antibodies against different antigens. Okay? Monoclonal antibodies. So monoclonal antibodies are produced by just one colon and in a laboratory. For example, when we say anti-HER2 antibody, it means that we have just one colon against this tumor marker. HER2 is a tumor marker, I told you. Is that clear? That's enough for the tumor immune system. Yes. The rest of the slides will be given to you in cancer.